Hello everyone, and I hope everybody is doing perfectly fine. So, in my initial lectures, I told you that I'll be discussing pathology chapter-wise also, and in between all these chapters, discussion we'll have based on general pathology as well as systemic pathology pertaining to individual systems. So, in addition to that, I had told you I'll be dealing with the chapters CBMA के according जो NMC की guidelines है competency based study according to that. Then also I had told that I'll be discussing some diagnostic approach to certain rare cases, and also that I'll be discussing your practical pathology which you get in your MBBS exam, practical pathology. So that in that what you are given is histopathology slides to identify or as a spotter, fine, or to write description about it, okay, what you are seeing and what is your diagnosis. So this is basically from एग्जाम पॉइंट ऑफ व्यू जो इनिशियल जो मेन डायग्नोस्टिक फीचर्स होते हैं वो मैं डिस्कस करूंगी related to different pathologies. So I had started with acute appendicitis also. I had discussed fibroadenoma as well in my previous lecture. So today I'll be discussing about mucinous cystadenoma of ovary and teratoma. So let's see gross और microscopy आप कैसे identify करते हैं. So mucinous, so few points about your mucinous cystadenoma. Before we delve into the slides, the gross and the histopathology, we should know about the basic features which mucinous cystadenoma of ovary has. So these are more commonly unilateral होती है ज़्यादा as compared to your serous. More commonly unilateral है, serous are usually bilateral. So these tumor they arise from your coelomic epithelium that differentiate along the या तो endocervical type के differentiate करते हैं या intestinal type of mucosa के साथ differentiate करते हैं ये. So like serous borderline tumor जो हमारी epithelial tumors of ovary की classification है उसमें आप देखोगे the first one is your epithelial tumors. So उसमें आता है हमारा serous tumor, mucinous tumor, seromucinous tumor. So on we have the classification, and this each serous tumor is divided into your benign serous cystadenoma, borderline serous cystadenoma, malignant cystadenosarcoma, malignant serous cystadenocarcinoma types. Fine. So similarly for mucinous tumor also like serous we have this classification. Benign mucinous cystadenoma, borderline mucinous cystadenoma होती है और mucinous cystadenocarcinoma. So this is how the mucinous cystadenoma of mucinous neoplasms of ovary is classified. So bilateral mucinous adenocarcinoma of ovary is rare, and वो होती कब है? We usually find it with your metastasis when the tumor has already spread. Now this discussion is basically your confined to gross and histopathology features. So now see, I gave you an overview of what a mucinous adenoma is. Epithelial, benign epithelial tumor of ovary है ये. Usually unilateral होती है. Now mucinous grossly, how will you see it, is usually larger than your serous type. Smooth surface cysts होती है. Characteristic multiloculated होगी containing. जब आप cut section देते हो, suppose a cyst is like this oval. When you cut it or open like a book, what you see cut section में multiloculations होती है cyst की, और वो जो multiloculated cysts होते हैं, they will be filled with your thick and viscid gelatinous fluid. And benign tumor है, so the wall is very thin, and septations जो होती हैं सारे loculations की, those are very translucent. और malignant से कैसे differentiate करते हैं? Malignant के very thick septations होती हैं, thickened wall, thickened septations. So those are the feature of your malignancy. Microscopy is very simple. जब आप cyst देखते हो ना, cyst मतलब एक cystic cavity है which is lined by your epithelial cells, and that is how you distinguish or identify which is the parent organ and what is the pathology in this cyst. तो cyst जो इसकी होती है, it is lined by your single layer of cells which have a basal nuclei and apical mucinous vacuoles. I'll show you the diagram. There is no invasion or papillae formation. That is how it is benign. Invasion हो जाए, papillae formation शुरू हो जाए, those are the features of your pointing towards malignancy. So this is mucinous adenoma. Cut section gross है इसका. तो आप देखो एक loculation है, दूसरा. So this is multiloculated. When you cut open, एक single cystic cavity नहीं होती mucinous में, ठीक है? Multiple loculations हो रहे हैं cyst के, ठीक है? और ये सारे जो फिल्ड अप होते हैं, these are filled, ये जो thick gelatinous material, अभी तो ये empty कर दिया हमने while doing gross. So normally this cavity, all the loculations are filled with thick gelatinous fluid. So this is how this picture I have taken from book. So due regards to that, Kyo's pathology. And here what you see is cystic cavity है जो कि lined है by this single layer, कहीं कहीं pseudo stratification भी दिख रही है. So here what you are seeing is single layered cuboidal epithelial cells हैं, ठीक है, elongated. As with the other image also, यहाँ पे बहुत ही plain है, कहीं कहीं pseudo papillae formation is there in that one. Here what you are seeing is a simple cyst, देखो आप cyst, which is lined by this is your single layer of cuboidal epithelial cells. Sorry, this one. ये सारे हैं. इस cyst में देखो यहाँ पे. So coming to the hyper view. So this is what I was saying. ये तो हो गई cystic cavity. इसमें आपके जो बीच का cyst है. What is the here what RBC दिख रही है. तो fibrocollagenous tissue है. माइंड थोड़ा क्यों इन्फ्लेमेशन हो रही है, लिम्फोइड सेल्स भी हैं बीच बीच में. बट आवर कंसर्न इज द लाइनिंग. ये लाइनिंग जो एपिथेलियल है, क्यूबॉइडल है, सिंगल लाइन क्यूबॉइडल एपिथेलियल सेल्स. और बेजली देखो डार्क 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 जो बेजली प्लेस्ड न्यूक्लियाई है, एपिकल प्लेस्ड न्यूक्लियाई, बेसल न्यूक्लियाई है. एंड व्हाट यू आर गेटिंग इज जो भी साइटोप्लाज्म है दैट इज म्यूसिन फिल्ड साइटोप्लाज्म. Pale है, it is not pink also. So all these are the cytoplasm of the cells are filled with your mucinous material. So this is mucinous cystadenoma of ovary. So that characteristically you have to identify key single line cuboidal epithelial cells that you can write cystic. You can write an exam देख सकते हो आप इसे section exam में show a cystic cavity which is lined by single layer of cuboidal epithelial cells. Is no true papillae formation or ATP are noted. Second point you can write is the individual cells, they have basally placed nuclei and cytoplasm is filled with your mucinous like material. So possibility of benign cyst adenoma of ovary is suggested. और gross में I told you that it is a cut section, external surface glistening smooth होती है. Cut section में you see multiloculation and all the multiloculated cysts are filled with your thick gelatinous fluid. So next, moving on to your benign cystic teratoma of ovary. So benign cystic teratoma of ovary, it is, or you can call it as a dermoid cyst of ovary also. Cystic teratoma, dermoid ovarian cyst, is more frequent in your young women, that too in active reproductive life. टेराटोमा जो होती है, इट ट्यूमर विच इज कंपोज्ड ऑफ टेराटोमा. तो हमने पढ़ा है पहले से भी, 3 जर्म्स लेयर होते हैं हमारे, एक्टोडर्म, मेसोडर्म एंड एंडोडर्म. फाइन. सो यू हैव ऑल द कंपोनेंट्स इन दिस टेराटोमा जो ट्यूमर होती हैं. either 1, 2 or 3 you can appreciate it. In my one of my lecture I recorded about struma ovary also, that is a dermoid. So उसमें क्या था, majority 90% जो थी thyroid tissue आ गई थी, that is also teratoma. ठीक है. सो ग्रॉसली कैसे देखोगे, सिस्टिक टेराटोमा जो बेनाइन वाली होती है कैरेक्टरिस्टिकली यूनिलॉक्युलर सिस्ट होती है. अभी वी रेड अबाउट मल्टीलॉक्युलेशन, आई शोड यू द कट सेक्शन. हियर व्हाट यू हैव इज मल्टीलॉक्युलेशंस आर प्रेजेंट. सो 10 to 15 सेंटीमीटर डायमीटर का एवरेज सेक्शनिंग में व्हाट यू गेट इज यूनिलॉक्युलर सिस्ट एंड द सिस्ट इज फिल्ड विद योर paste like sebaceous secretion or pultaceous material, you can say. Desquamated keratin admixed with masses of hair also you can see. You can see bone, then teeth, cartilaginous areas, hair, all these you can note. Cyst wall जो होती है वो thin और opaque grey white होती है, and sometimes you can appreciate some solid areas also. And this I told you, tooth, bone, cartilage, other odd tissues are also present. That is the characteristic feature of your teratoma. See this picture. एक cyst था यहाँ पे, in fact we got tooth also in this specific. So this is here you are getting unilocular cyst है, single cavity, and what you are seeing, hair coming out of it. So this is your hair वाला, more prominent is there, ectoderm. So see here what you are seeing, solid areas है यहाँ पे, and this is your proper hair. So this is an enlarged ovary cut section. What you are seeing, cystic and solid area. Some areas you are seeing hair. So cystic, this hair is protruding into the cyst lumen. माइक्रोस्कोपी में सेम सेक्शंस देखोगे आप कि ओवेरियन पैरेन्काइमा जब आप कट सेक्शन ओवरी जब आपका पूरा डर्मोइड सिस्ट में कन्वर्ट हो गया है तो सम टाइम portion of normal ovarian parenchyma you can note on sections. Fine. And what you are seeing is स्ट्रैटिफाइड स्क्वामस एपिथेलियम है, ये सारे स्क्वामस एपिथेलियल दिख रहे हैं आपको और पाइलोसेबेशियस एडनेक्शियल स्ट्रक्चर है. पाइलो मींस हेयर, सो यहाँ पे हेयर शाफ्ट भी है, यहाँ पे भी हेयर शाफ्ट है. ठीक है, शाफ्ट ऑफ हेयर यू कैन सी और यहाँ यू कैन सी अ कार्टिलेजिनस एरिया. ठीक है, दैट इज mesodermal tissue. So we can get ectoderm, endoderm, mesoderm. Fine. And sometimes we can get CNS, neural tissue also. So microscopy, benign cystic teratoma in different microscopic field when we will see, we'll see number of other mature differentiated tissue. ठीक है, ectodermal मोस्ट कॉमन होता है, स्क्वामस लाइनिंग दिख रही है आपको, हेयर शैफ्ट दिख रहे हैं, कार्टिलेज, सो दोज आर मोर ऑफ योर दिस ectodermal टिश्यू. mesoderm I showed you, मसल देख सकते हो आप, कार्टिलेज देख सकते हो. सो लाइनिंग ऑफ द सिस्ट जो थी हमारी स्ट्रैटिफाइड स्क्वामस की थी और एडनेक्सियल स्ट्रक्चर्स व्हाट वी कैन सी, सेबेशियस ग्लैंड्स, स्वेट ग्लैंड्स, हेयर फॉलिकल्स, these all you can note. Then tissue of mesodermal and endodermal are commonly present, जैसे कि आप bronchus, intestinal epithelium देख सकते हो, cartilage, bone, smooth muscle, neural tissue, salivary gland, retina, then pancreas, thyroid tissue when it is tumor, ovary. So you can see multiple structure of this, multiple different structure which are derived from your ectoderm, mesoderm and endoderm. सो अनदर इमेज देखो, यहाँ पे कार्टिलेजिनस एरियाज दिख रही हैं, यहाँ पे फैट दिख रहा है. ठीक है, सो हियर यू कैन सी mesodermal, जिस पहले मैंने ectodermal दिखाया था, दिस इज mesodermal. So this diagram is in Harsh Mohan pathology practical manual. Here what you are seeing, glands दिखाए हैं उन्होंने. So like this, these are important when you draw your diagram for your exam also. So it is very important that when you describe a histopathology slide, so you have to mention this with proper diagrammatic representation ki what you are seeing in the slides. Fine. So here you are seeing glands, then stratified squamous lining दिख रही है, smooth muscles you can show here, or you can appreciate with your adipocytes दिखा सकते हो आप, fat cells, cartilaginous areas दिखा सकते हो. Fine. Then you can show कि epidermis हो गया, muscle already have shown you, columnar epithelium, cartilaginous area. So different ectoderm, mesoderm, endoderm derived areas होते हैं. You can draw proper diagram and show. So thank you so much for your patient hearing. I hope these both slides are very clear. So kindly like, subscribe and share my channel. Thank you for your patient hearing.